Right. And good afternoon again, everyone. Thanks for joining us. If you're watching this as a recording, thanks for following up and your interest in this opportunity. We're going to take some time here and chat about the microgrant opportunity, particularly for addressing social determinants of health in Staten Island. This is a partnered opportunity. So my name is Michelle Bascom from Nonprofit Staten Island. I serve as a director of programs and development here, and we're offering this not only information, but this opportunity in partnership with the funder, Staten Island Performing Providers System. You may be more familiar with them. SIPPS is what they would often go by. So just very quickly, if you're not quite familiar, a little bit about the two organizations here. Nonprofit Staten Island, we are formerly known as SINFA, or the Staten Island Not-for-Profit Association, has been around since 2005 and provides the nonprofit sector writ large with tools, resources, and advocacy, specifically to enhance collaboration and culturally responsive community building across Staten Island. We also aim to provide supports and opportunities to connect our borough more wholly with other New York City agencies, providers, and networks. So that's Nonprofit Staten Island. We'll be providing technical assistance throughout this RFP process, and to the organizations on the flip side, we are a membership association, but this is an opportunity open to everyone. And then Staten Island Performing Providers System, or SIPPS, is a large network of healthcare, essentially healthcare providers, and those invested in the work of healthcare that's dedicated to improving health equity. Specifically, they hold conversations across the Staten Island community. They create educational and workforce opportunities, especially those geared towards younger people entering the workforce or reskilling for the workforce. And they aim to bridge connections with non-traditional service providers and the health community, especially to better meet people where they are and close the gaps on some needs. So SIPPS has been doing wonderful work over the years, really building health equity. And you'll see as we go through some of the RFP information today, how this opportunity really speaks directly to that last piece of their mission and of their work, helping to build the gap with our CBOs and our nonprofits who are serving ground level in the community and bridge those gaps to our healthcare systems and providers, both for immediate impact and for long-term benefit. So welcome again. A little bit what we'll go through today, our quick agenda. We'll do an overview of the purpose of this RFP and run through the eligibility criteria. We want to make sure everyone who's listening in thus far and intends to apply is in fact eligible to apply, and share a couple of ideas and examples for possible projects. These will not be by any means the only projects that you can apply for, but just some ideas to get us thinking. And then we'll go into the application and a walkthrough of the application materials, as well as the evaluation materials. So we want to make sure to give you a sense of what the committee structure looks like for evaluation, of course, what the criteria is, and our next steps timeline. Hopefully I'll be able to do that overview for you all in the better part of a half hour or so, and we can leave some time for Q&A. Anyone who's with us, live in this session can ask any questions that they happen to have. We're happy to answer. Anything we can't answer on the spot, we'll be following up with SIPPS and make sure it's included in our FAQs that will be published next week. So let's jump right in. Overview to start. We want to, and I will say that all of this material is also available in the downloadable PDF of the RFP, but a little bit more visual here today, a little bit more explanation behind the text. So the purpose of this funding opportunity, first and foremost, is to address social determinants of health, especially those impacting Staten Island, and especially those impacting vulnerable communities or vulnerable populations. The idea is to provide support to CBOs, to nonprofits that help meet the needs affecting health and well-being across our communities as a way to continue to build health equity beyond the healthcare system, outside of just medical visits and medical institutions. The aim here in addressing the social determinants is to support varied approaches. So again, we understand there's no one size fits all when it comes to tackling disparate needs across communities. And so a whole host of approaches are likely to be funded through this opportunity. And we look forward to helping coordinate the future collaborations across those who are awarded and others doing the work. That being said, building capacity of those organizations, not only as collaboratives, as a network, but as individual organizations. So the aim of this funding is to strengthen or expand existing programs and services. So to be clear, we're not looking for new ideas, new programs that you'd like seed funding for, but really it's about enhancing your capacity to deliver on work that's already being done. Ultimately, SIPPS aims to assist CBOs in overcoming what I've kind of phrased as internal barriers. Sometimes as a CBO, you've got city funding to do this education program, and you know it's helping the health of these young people. But if you just had this little bit more money to do this one thing, you think it'd be better. That's the type of project we're looking for, what your internal barriers are. Maybe you need more incentives to bring folks to the table. Maybe somebody just needs a training certificate so that they're eligible for a new service. Whatever that capacity need internal would be, that's what we're looking to support. And building capacity as well by providing TA support. As I mentioned, Nonprofit Staten Island is on hand throughout this process. And so you can always reach out to me. My contact info will be at the end. It's on our website, all that good stuff, if you find that you need any support along the way with this process. The final prong, I guess, of the purpose here for this funding is to build additional partnership, to expand partnership on the island. So the idea is for engagement of new partners. That's for SIPPS. They've done a tremendous job building their network over the past several years and engaging a number of community groups, community-based organizations, and even faith-based organizations. The purpose of this funding opportunity is to, look for those who have not yet engaged. And here at Nonprofit Staten Island, we're always happy to engage new partners. So we share that purpose and ambition with them as part of this opportunity. By building partnership, right, by building collaboratives and introducing new folks to this opportunity, we hope to bridge those gaps between CBOs and healthcare systems and providers. As I mentioned, that's a real mission-focused piece for SIPPS. And so this is the beginning of that, right, for some CBOs who might not yet have that connectivity. We think this is especially important, at Nonprofit Staten Island and in our conversations with our partner at SIPPS, because looking forward, we understand that there will be a tremendous amount of opportunity for nonprofits and more CBOs to do increasingly more health-focused work. We expect there to be a lot more funding that comes down the pike and a lot more engagement and interconnectedness or interdependence even between the healthcare system or sector and our community-based groups. So the idea with this opportunity is to start building a foundation that organizations can then look ahead and have some language under their belts, have some connection and network under their belts. And of course, bring together those collaborative efforts of different stakeholders for, again, now short-term projects and improvements, but also looking ahead, longer-term impact across the community. Just to quickly clarify, in case it's a question floating in anybody's mind, what we're thinking about or looking for in terms of social determinants of health, organizations might be addressing one or more of these social determinants, and it could be in one or more zip codes in Staten Island, right? So social determinants of health are typically those things that influence an individual, a family, a household, on a day-to-day that doesn't explicitly connect on surface to their physical or mental health, but we know absolutely influences ultimately their well-being, their access to care, and their overall health outcomes. So these are things, and you see them on the screen, they're in the RFP listed out. Folks can, of course, read through it, but these are things like housing and food access and workforce. Workforce might be employment status. It could be underemployment, unemployment within the household, right? Whether or not the employment that the adults of a household have offers health insurance, right? Transportation and safety and legal, these are all things, again, that can present barriers in day-to-day life that on surface, having transportation challenges or facing a legal challenge might be its own issue for a family or a household. We also know that that's likely to impede their health outcomes. And so that's why we're thinking of them as social determinants and influence factors. And so we're looking for organizations that are addressing one or more of these. Do not feel like you need to have multiple of these, checked off in order to apply. If you're focused on one through one program, that's great. And we'd love to hear about how you look to expand that work. I'll also just point out briefly the last two bullets here that are on the right side of the screen. These are kind of target initiatives for SIPPS right now. And so while they are a little bit more explicitly connected to health than some of the other social determinants, these are important, and SIPPS would love to see projects in this regard. So medical and hospital needs, and this might mean you're already connected or working with health providers. We're thinking about how to improve access to medical care or to hospital treatments for particular populations, and also then around maternal health and postpartum health. So these, again, target initiatives, not at all required for you to be focused on, but we welcome them as kind of non-traditional social determinants you might not have thought of. But if you have a program that's applicable, we'd be happy to hear about it. So then there's the eligibility piece. Let's say that, yes, you have one of those programs. We want to make sure that we just kind of go through this eligibility checklist very quickly. This is essentially going to be used as a screener, right? So before we read someone's full application, we're going to kind of look for these check boxes and make sure that they are eligible. If there are any flags here, if we're screening an application that has come in and we're not sure how to interpret an entry, we will reach out to the point of contact that's listed on the application to get clarity. So for example, first bullet point, current 501c3 status. If for some reason you indicate on the application that you're not sure if you're current in that status, we're going to reach out and ask you to verify that, right? And make sure that you are an eligible 501c3 organization. We also ask that you be registered with the New York State Charities Bureau. Typically, we see that this can be a compliance challenge for some of the smaller organizations, those grassroots groups. Sometimes it's not even on the radar that you're supposed to be registered with the New York State Charities Bureau. So if for some reason that's a concern or that seems to apply to you right now as I'm saying it, today's a great day to start looking into that. You might want to go check your registration with the Charities Bureau and get that underway if you're not registered. And two, strongly encourage you to reach out to me and kind of flag that's a concern, but you're interested, and we can kind of talk through whether or not there are options here to get you through the eligibility screening. The other eligibility components, as I mentioned, have to have a current program or service that's addressing one or more of those social determinants in one or more zip codes. So that's referring to this list that we just looked at. You have to have a program or service doing one of these things at a minimum in the borough of Staten Island. And then finally, and this is one that may bum out some of our partners because, again, SIPPS has done a tremendous job building its network. But this is an opportunity exclusively for those who are not current recipients of SIPPS funding. So if you're currently being funded by SIPPS, you will not be eligible to also apply for or receive funds from this microgrant opportunity. If you're not sure, and or if you were funded by SIPPS, let's say for a pilot project 2 years ago, and you're not sure if that kind of counts for right now, again, I encourage you to reach out to me and just ask. That's what we're here for. That technical assistance piece, we can liaise with SIPPS on behalf of interested partners and would-be applicants. And if you're, again, unsure if this is applicable to you, just reach out and ask. The worst we're going to say is, sorry, you're not eligible, but best case, maybe we say, sure, go ahead and apply. So please do communicate with us if you have any concerns on these eligibility criteria pieces, but this will serve as a screening tool. So all applicants will have to check all these boxes before we go ahead and read that full application. The application, of course, will reflect your project. So we're going to offer 3 quick examples here. By no means is this comprehensive, and it doesn't, these are not the only types of projects you can do. These are not the only project topics you can think or talk about or propose for. They're just ideas to get you thinking, and they're spelled out in the RFP as well. So one example here, if you have existing health coaching services, or maybe health navigation services, or maybe health literacy, where you do workshops at your community center or something, and you're looking towards this funding to help you scale those services. This could include new topics. So maybe you are currently doing health and nutrition workshops, and you'd love to add in content or educational sessions for those with chronic illness, which is another target initiative for SIPPS. It's a area of interest for them. So maybe you want to add in some work for chronic illness, or you want to add in health sessions that are specifically targeted to senior citizens, those age 60 plus, let's say. So that would be new or additional topics and content. Maybe that's how you want to scale, and you're looking for funding to get that going. Or maybe you're starting to see retention challenges in your health coaching. You do one-on-one coaching, but it turns out that a lot of your clients actually can't get to the community center where your coaching is available. Maybe you would need funding for transportation stipend incentives so that you can offer Metro cards and help people get to your location for health coaching. Could be things like refreshments if you are doing large groups. Sometimes serving people lunch will make more people come. So you can think about that. The idea here with this example is you're really looking for scalability, right? You've identified that you can serve more people with, and then we'd love for you to explain what that looks like and how the funding would tie to that. Another example is maybe you're just missing on some credentials. Maybe your staff needs a particular training to be able to introduce postpartum support as part of their women's services. Or maybe you do some food access work, and if you just had some staff with the food protection certificate, what we usually call New York City food handler's license, maybe then that staff getting that certificate, you could do more with your nutrition. You could actually prepare food on site, or introduce delivery services for homebound seniors, or something to that effect. Or maybe your organization just needs a license to be able to provide a specific type of service. And again, sometimes it's those internal barriers that I mentioned at the start. Sometimes you just can't fit it into any other budget. You'd love to, but the city's not paying for the food handler's license, or you just couldn't get that budget line in for one more training session, or that consultant that could really bring the work to the next level. If that's a need, that's what we'd love to hear about. And of course, how that expansion is going to better serve the community, more people, better quality in terms of your program and your service. A final example here is equipment or technology. Maybe you just need some hardware or some software to improve or expand services. So it could be more people will come to let's say more of our young people could go further in our workforce program if we were able to offer laptops, if we had more tech on site for that. It could be something around senior services programming. We'd engage more seniors in addressing this social determinant if we had this equipment on site, or this monitoring tool. Softwares could also be things for maybe quality improvement. And this, again, is especially true for smaller organizations, grassroots groups. Sometimes there's a challenge in capturing your work and your impact and actually reflecting that data. Sometimes you just need a software to help, and it's hard to find that type of general funding to say, hey, we need a tool, we need to invest in a tool, and we need the training that goes with it so we can really start improving the quality of this program and serving more people by streamlining, by doing our data-driven work. And if that'll help expand services or improve the outcomes for those you serve, we would welcome that type of project. So it's, again, not all inclusive there at all, but just some things to get you thinking that it really can vary. We're open to funding different, elements of a program or an operation that'll help overcome that internal barrier that you may be facing in order to better serve those who you serve and increase the number of clients that you're able to impact. Looking at the application, it's going to ask you essentially to talk through, for us, everything I've talked through so far with you. First and foremost, the application is Google form. So everyone will be filling out the Google form. It's available at this website that is huge on the screen and at this QR code that's huge on the screen. And of course, we will be sharing this and continuing to share this on our social media, in our newsletters, all that good stuff. Drafting templates are available for download on this website. So because it's a Google form, we can't guarantee that it'll save your progress as you're entering your application. We strongly encourage everyone to draft either in Google Docs or Microsoft Word. And those templates are available for download on the RFP site. So you go to this site, you'll be able to click and get the full application, which we're going to walk through the sections in a moment. You'll be able to get the full application in Google Docs format from which you can make a copy or do a hard download into Microsoft Word. And then you'll also have the option to download the budget template, which will come up in Google Sheets, and you can make a copy or do a hard download into Microsoft Excel. So drafting templates available for download, but at the end of the day, everything gets submitted on the Google form. So we're not going to accept attachments of those completed drafts. We're going to want you to do your draft and then go onto the website, put that Google form and fill in your information in your proposal. First section, org information. This is basically the screener. This is basically eligibility criteria. We need to know the org and who at the organization we should be communicating with. And we're going to ask you to just verify your 501c3 status along with your EIN, which would be your federal tax ID, and your New York State Charities Bureau number so that we can verify that registration with the State Charities Bureau. Straightforward, nothing to see here, just filling in contact info. Section 2, we're looking for some information about the current program or service that you're looking to fund, that you're looking for this capacity building funding for. So we're going to ask you the name of that current program or service. It might be a specific program. It might be like a division or a department within your organization. However that's structured internally on your end is totally fine. We just want to know what to refer to it as. And a description of it. So the narrative part here, and you'll see these prompts that are on the screen. They're also there in the application for you. Kind of an overview of what problem does the program currently address? What population does it serve? And you could include notes there around cultural responsiveness if you feel it's relevant. Tell us a little bit about the goals of the program, what activities are part of it that kind of align with those goals, and how it's currently being implemented. So you'll see there is a 2,000 character max here. For context, that's about 3/4 of a page, probably, give or take. So it should be enough to answer these questions. Don't feel like you have to go one by one by one. The way that the questions are lined out, you can, if that's helpful for you. But as long as you're capturing this information in some sort of narrative format, we're happy to review it. This page will also, or this section will also ask you about the priority populations that you are currently serving. You'll see a full listing on the application, both the template and the Google form. The priority populations are those which SIPPS designates as priority. And this will include Black and African American populations, Hispanic and Latinx, AAPI communities, as well as older adults, 60 plus, younger children. And I think there's those uninsured, so without health insurance, those who are unemployed, and there may be one or two other little options there, but you'll see them listed out. You'll also see defined in the application, a priority population currently served means about 30% of your current clients would identify within that population. It's okay to not check off super too many boxes. We just really want to understand what your current programming looks like. Same thing for the service area. You'll see a listing of all the Staten Island zip codes, and you're going to just check off whichever one or ones you are currently delivering this particular program or service in. So if you're delivering it at a community center in Stapleton, then 10304. And if people do have to come to you to participate, then that's that service area. If you're going to expand with this funding, that's fine. That's for the next section. Right now on this section 2 part, it's about where are you currently serving? And it'll ask you also the average number of clients served. So that'll ask you about fiscal year 23. Since we are releasing this right here at the end, everybody's probably doing their closeout reports and crossing their T's and dotting their I's on their data for the year. So you're going to just look at number of clients served in FY23 and enter that here. It'll also give you the option to indicate how you measure clients, whether it's individuals, families, households, right? It's a little bit different. Some folks might say this program is for full families. So we serve 20 full families. That's different than 100 individuals, even though they are one and the same, right? So you'll have that option to indicate that. Section 3 is where we start getting into the heavier narrative, the request for actual project funding. So we'll ask now, what are your projected number of additional clients served, right? The goal is to help enhance your programming. So now we had your FY23 number in section 2. For section 3, with this funding, how many more clients do you expect to be able to serve? An estimate is helpful, but this will be captured on the requested reports, of course, for our awardees. So try to make a fair estimate. And then the narratives here is really looking to understand what you propose to do with the funding, right? Challenges, what challenges or barriers are you currently facing that are making it difficult to deliver this program, or that are preventing or hindering the organization from making a greater impact? We just, again, a bit of a narrative. Maximum is about 3/4 of a page, but just the prompting questions, the guiding questions are there for you, and you can use those as your thought prompts to help us understand and the review committee understand what it is this funding aims to solve. And then it goes into proposed solutions. How would you solve this, right? If you tell us that the barrier is we don't have a data collection tool, or the barrier is transportation for our clients, what solution are you proposing here? How are you going to address that given this funding? And then give us a little narrative, right? Tell us how you came about those client numbers. What's going to be added that will expand your impact, that will improve sustainability, that will bring in greater service provision. And then the final prompt of this section is back to those priority populations. You have the option here to describe, if you feel it's applicable, your organization's experience serving the one or more priority populations. I do encourage organizations to respond to this question. I believe it's an optional question, but it really will help the review committee and SIPPS get an understanding of your current engagement levels with priority populations, whether it's just one or whether it's, multiple within them, or if there's intersectionality where you're serving, predominantly Hispanic, older adults. You would speak to both of those priorities. And so how that will play out also in your proposed solutions, we really encourage you to think about and to speak on. In our solution to the current barrier, this will help this particular population in these ways. So that'll be section 3. And section 4 is a bit of a project plan. This doesn't have to be full paragraph format. These can kind of be bulleted action items. And it's a little bit of a standard program plan, as it were. We ask you first about benchmarks. So you told us what your solution is. Just benchmark out for us, what are those action items, right? So this is your solution. How are you going to put it into action? What are you going to do, essentially? And then what deliverables will go with those action items? So if you are doing a credentialing and you're getting, we're doing this training, and then we take the test, and then we set up our sessions with our newly credentialed trainers, great. What are the outputs, right? How are you going to then measure some deliverables around that? X amount of people have been credentialed. X amount of clients will be served using this credential, right? And the timeline that goes with that. This can be an estimate. It is a 6-month performance period, so it's not a full year. And this is where you have an opportunity to just outline, again, bullet points are fine, when these different activities and deliverables would be achieved. What can we expect you to accomplish by the midpoint? Maybe, 3 months in, what's your first month ramp up? What does 3 months in look like? And what will you accomplish by the end of that 6th month within the performance period? And the final piece of your project plan will be your outcomes. I know as someone who works on a lot of grants and things, sometimes it can get fuzzy, like thinking about outcomes versus deliverables, and aren't they the same? And, so we added this guiding question that we hope is helpful. Essentially, if all your deliverables are met, what is the measurable impact, right? Your deliverables are those kind of SMART goals, those measured number of things you're going to do with your action items. The outcomes we're looking for is really the impact on the community or the clients. So writing about short-term and long-term is encouraged. We'd love to hear about both. And again, I encourage you to use the prompt, draft it, think about it, go back to the deliverables and say, okay, well, great. If we get 3 more staff credentialed in this, it will benefit the community like this. It will benefit a priority population like this. Health access will improve by X. And that's really where the outcomes come into play. Then the final piece, of course, is a proposed budget. And I'll just say about this part, it's going to be an upload. You have an option to do this one of 2 ways on the Google form. One, you can upload your budget directly. The only thing is, it does need to come from within Google Drive. So you won't have the option, unfortunately, to upload from your computer or your device. So you will need an access to a Google Drive in order to do a direct upload. If you don't have a Google Drive in your organization, or you're not going to use a personal account for it, that's okay. You'll have an option to do manual entry of your budget. And that'll essentially be section by section in that Google form. It'll just continue on. The minimum project budget that we'd like to see is $5,000. The maximum request that we would like to see is $10,000. No funding will be awarded over $10,000. The maximum overhead award will be 10% of your total budget. Whatever your total proposed budget is, your overhead should account for no more than 10% of that. So then we'll also ask the last part of the budget is a brief description or narrative. A little typo on my slides there, narrative for each category. You see on the screen here, the overview. This is a section on the budget template that will autofill as you go through the template and start filling in your information. And it's just here to give you a snapshot of the various categories. The next few slides will take you through those categories quickly. We've got personnel on the left. Sorry, it's a lot on the screen at once. I thought I animated it. Yeah, personnel and supplies on the left, and then you see some of those sub sections that are on the template broken out: full-time staff, part-time, and fringe. For supplies, we broke it into office supplies, project, refreshments, because sometimes refreshments really is its own whole thing, or other. And if you don't have something for a section, that's okay. Leave it blank. No need to stress about it. You would just leave it blank. It'll be 0000, and that's not a problem. If you have nothing for an entire category in the description section, you would just put NA. Not a big deal, because if you're not requesting anything, we don't need you to describe why not. On the right side of the screen, you see some other categories here: training and credentials, which of course, as we said, it could be a whole project in and of itself. Our sub areas here are consultants or training materials, those credential fees or licensing fees, and other. There's always an option for other. We understand in the nonprofit sector, sometimes there are just random things that don't fit quite clean into the buckets that folks give you. So we want to leave space for that. And we would just ask that if you are putting expenses in these other lines, you really make sure to address them in the descriptions. Equipment and technology, again, its own category. Could be hardware, could be software, could be something else. I'm not sure what else it may be. Furniture, maybe? I don't know. But if you find that it fits in the other, you would just put it there. And the last 2 categories that will be on your template are transportation, and then, which can be for staff, or if you're doing stipends and incentives, I suppose you can also put that here. And then the miscellaneous towards the end. So miscellaneous is, again, a catch-all. We don't expect too many people to have miscellaneous expenses, but we wanted to be mindful that it's possible. And then your overhead, again, a max of 10%. Each section will prompt you for a description, and we encourage you to make sure that you provide it. If you're not requesting funds in a category, as I said, NA in the description box is totally fine. But the descriptions are important and really can go a long way in the evaluation of your application, which we'll see in just a minute or two. The descriptions on your end should provide a clear picture of how the funds will be spent, especially in alignment with your project plan. So the idea is the reviewers would like a sense of how is this spending going to get you to this outcome, right? If you've told us these are your deliverables and this is the benefit to the community, we'd like to know, how does paying this person's wage or how does buying this piece of equipment get you to that place? And that's what the description box is for. It doesn't need to be a whole thing narrative, but a couple of sentences can go a long way here. As you're doing that and reviewing that and while drafting it and reviewing it, you're going to want to make sure that your budget proposal clearly aligns with your narrative proposal. This can be one of the greatest shortcomings when putting things together. Sometimes your fiscal folks have one idea, your program peeps have another idea, and then it's the supervisor who sends it in, and you're kind of like, well, that's what we said, right? But make sure that you really match and line up your narrative with your budget piece. And overall, that it's all aligned with what SIPPS is really looking to fund. You can go back to the early slides of this PowerPoint and review the purpose of this funding and the priorities for SIPPS and make sure that you're really speaking to that in your request for funding here. And then our last section, just an overview of evaluation, and then we'll be able to kind of do Q&A on all of this information that I've just thrown at you. So the review committee, this is a very brief note because admittedly it's still in development, but we wanted to be really transparent with what this will look like. The review committee will be comprised of 5 members, cross-sector nonprofit leaders. So we're looking at leaders in the community who are currently in institutions or organizations that partner with SIPPS. So they're familiar with SIPPS, their work, and also how they operate as a funder. And they will, ideally be cross-sector. We are looking, of course, for some leaders from the health and wellness sector, but social determinants of health, as we saw, really span beyond just medical. So we're also looking at CBO leaders, education leaders, and things like that to join this review committee. All committee members will be provided with an evaluation rubric so that it's a standardized scoring method. And all will be provided with streamlined formatting of everybody's application. So I wanted to make sure that was really clear to folks, especially for the budget piece. It doesn't matter whether you upload it as the template, as a spreadsheet, or if you do the manual entry. I don't want folks to be worried that it's going to look bad to the review committee if we have to do it this way. We on our end, this is part of our TA support, we will streamline all formatting before it goes to the review committee so that it is equitable and everybody's just looking at the same type of application. And then of course the words are your own. An overview here of the evaluation criteria, and you can find this spelled out further in the RFP, of course, towards the end of it. 1, the service area and population of your program that your program serves. This will be 15%. There will be additional consideration or priority consideration given to programs that are serving in high needs areas. So those are generally North Shore zip codes 10301, 02, 03, 04, and 10310. But all are welcome to apply. It can be any service area, but that will get some additional consideration. And for underserved populations, which are generally those priority populations that I've been speaking about. Service provision, and that's essentially your current services. This is considered at 25%. We'd love to see applications that demonstrate your existing program or service is 1, relevant, right? We need you to prove that it really is aligned with at least 1 social determinant of health in its execution, and 2, that it is of quality, essentially. Of course, we're asking you to describe the barriers, the challenges, so we know it's not perfect. But we do want to know that your current service provision is operationally sound, it's, ethical, it's impactful, it's gaining, it has engagement within the community and relevance to the community. So that's the service provision piece. And then the two larger sections, slightly larger than that, the project plan itself is at 30%. That's presenting a clear vision for where your project is headed, right? That's where we're asking you to say, hey, what are your solutions here? How is it that you're going to overcome these barriers? And did you give us benchmarks that will get you there? So half of the battle is knowing how you're going to improve or expand your program. The other half is saying, we actually have a plan for that, right? We're able to put together a timeline and some action items that will get us to our goal and align with that vision. That will pair with your use of funds, and that's 30%. This last one, I want to be clear, we'll consider this last use of funds bucket criteria, will consider both narrative and your budget proposal, right? So at 30%, we're looking at not only do you have specific deliverables, right? Something that our funder can actually say, hey, our money achieved this, right? This was the deliverable. But beyond that, does it align with your budget? And I spoke a little bit about that already. If you're saying that these are the three things your funder can count on you to do, does your budget actually get you there? Is your spending going to support the timeline and the deliverables that you put forth? Because we want to, we always want to make it make sense, both for the CBO, for the organization, as well as for the funder, so that it's in best service overall to the community. So this is the criteria writ large. This will be again put into a bit more of a formal rubric format for our review committee. And all applicants can find this laid out in the RFP so that we're super transparent about what it is we're looking for in each application. Then the final piece here from me today will be just the next steps timeline. I left out everything that came before because we're here today already. I maybe could have put today's date at the very first little stop bubble there, but we released this RFP last week on June 21st, 2023. Today is our info session. This is June 28th, 2023. And so the timeline on the screen now reflects what our next steps are for the duration of this opportunity. Today, we'll take some questions if anyone in the room has them. And we're also inviting folks to share any questions that they may have via email. You can email me directly. It'll pop up at the end of this presentation where folks can find me if needed. And we'll make sure to publish an FAQ document next week. So the end of next week, which I believe is Friday, July 7th. And we'll capture here any questions that have come in regarding this RFP to date. I do expect we'll probably update the FAQs at least once throughout the application period, but the first publishing of it will be next week. And so folks can look there if they have any lingering questions, see if anyone else has asked them. And then August 1st is our closing date for applications. So everybody's got just a little bit over a month as of the time of this session. August 1st, applications are due. We at Nonprofit Staten Island are with you that nonprofit work, there's never any rest for the weary. We will give you all the way until that midnight deadline. We understand that 5 p.m. is not always the end of a nonprofit worker's workday. So you'll have until midnight on August 1st to submit your application via the Google form that's published on the website, shared earlier, and it'll be shared on our closing slide here. Our review committee will take about a month to review everything that comes in. We'll be preparing things for them along the way. And then we expect to notify folks of their award September 1. So all applicants will receive some notification from us on September 1st. If for any reason our review committee is delayed, our notification will say that, and we will be sure to communicate and let folks know that. But we expect to be able to keep this on track. And if folks are accepted, those who are awarded, it'll be up. I can't believe this wasn't on my slides. Forgive me. Up to 5 organizations will be awarded. I should have said that quite earlier. Yeah, up to 5 organizations will be awarded, and they'll receive that notification on September 1st. And then we have the project period. So there's 1 month for people to kind of get organized there. If there's internal work or ramp up or correspondence, paperwork, signing contracts, all that good stuff, we'll have from September 1 through October 1 to do that. Again, we remain available here at Nonprofit Staten Island to lend support, but that's really where the funder will step in, and SIPPS will be setting up its documents and fiscal work with everybody. And it's a 6-month project period. So from October through March will be the full run of your project. And there's an interim report and a final report. And those dates have already been set. We're looking at January 15th and April 15th. Here at Nonprofit Staten Island, we'll probably provide some further guidance and support in the project period to those who were awarded in case it is needed to complete those interim reports. But long and short is that SIPPS will be looking for your updates and numbers to align with the deliverables that you put forth in your application, right? So if you say that this is our proposed timeline, we'd want to see what you've accomplished in that timeline at the interim, let's say 3 months in. If you're on track, awesome, tell us about it. If you're off track, it happens, tell us about it and how you propose to get back on track for your completion of deliverables. So that's really where the reporting will be. Nothing too surprising there, nothing too out of the ordinary. We want to make sure, and SIPPS is really committed to making sure that this is manageable for any size organization, from the grassroots groups up to the multi-millions. We want to make sure that no matter what each org's capacity is, you're eligible and able to manage this micro grant. So I will pause there. I want to make sure we have, if there are questions in the room, that we can take them. And I'll also kind of throw my info up here on the screen while people think about if they have questions or not, and we get going here. But if you wanted to follow us on social and you're not doing that yet, contact info up top there, or social info for Nonprofit Staten Island and SIPPS. Perhaps more importantly, my contact info and our RFP page are listed there on the second half of the screen. So you can reach me at Michelle@nonprofitstatenisland.org. Michelle has 2 L's. Nonprofit Staten Island is a long name, so try to check your spelling. And my cell phone number there is up there as well, in case folks need to reach out by text or call. And thanks a bunch. Let me pause there and see if anyone has questions.
Hi, Michelle. This is Patrick Mooney from Wagner College. I had a question about how you doing. So we're not funded by SIPPS, but we're curious if there are others that are thinking of applying who might need an education partner in the health sciences. And is there some type of forum or way to match up partners for this project?
That's a great question. There's no formal, matching coordination thing in place as yet or at the moment. But certainly I think that is part of our technical assistance role here, is we'll be fielding interests and inquiries from different orgs kind of along the way, who might want to apply and chat with us about it. And of course, we can make mention in those conversations that you're, that the Wagner College would be interested in being an educational partner, for sure. I will just flag, it is a micro grant opportunity. So with the max of 10K, not too many orgs may want to be in like a subcontracting position, but I know Wagner College has been doing a tremendous amount of just community work. So if you all were just looking to kind of lend support, certainly, yeah, we can make sure that gets on people's radar, and you and I can do a little more thought partnership on how to do that. And then if the college did want to put forth its own application, even if it's just for that education piece, and then you wanted help connecting with CBOs to deliver, we could also maybe talk about what that program model looks like. I think it could go both directions there.
Okay. And just some background for you. So we have a School of Nursing. We also have a physician assistant program, and we're starting a new occupational therapy program. So we do have expertise in all those fields.
That's awesome. There's a handful of workforce CBOs that'll be happy to hear it.
Great. All right. Thanks, Michelle.
Hi, Melissa. This is Pat Tucker. I'm on the call as well. I'm the Dean of Nursing at Wagner. I don't know if we've met, but I've done quite a lot of work with the PPS in the past. I'm sorry, can you hear me?
Yep, I can hear you.
Okay.
Great.
Nevertheless, nursing accrediting bodies and the state, as well as curriculum experts, are asking nursing faculty to incorporate more and more interventions, if you will, that have to deal with that deal with the social determinants of health. Of course, we teach that in many of our classes, and in a baccalaureate degree in nursing, we have a community health class that, digs very deeply into the CDC's social determinants of health, the WHO, and of course the Healthy People 2030 document. So my question is this: yes, we do a lot of community work, and much of it is linked to our clinical components. Of course, in nursing, you have your didactic, but for almost every moment that you're in the classroom, you're double and tripling that in a clinical site. So my question is, we have recently reached out to, and again, we're in a lot of non-for-profits, but we've recently reached out to Port Richmond High School, Eden 2, in regards to our pediatric teaching. Would educating not only the Life Center at Port Richmond High School is where the young students that have given birth can put theirs. So we've been just recently going back to Port Richmond, and we want to build out a program there. Would something like that, like we, as Patrick said, of course, we have the nursing program. We're working closely with Port Richmond. If we were to formalize or create, better programming with this one site, or even with Eden 2, is that the partnership? Like if Pat had asked I'm tongue-tied. Pat had asked if there's anybody out there that would like to partner with us. I think we have some of those partnerships already, and Pat and I have yet to even, dig into this because a lot of nursing programs are creating programming in and around those exclusive social determinants of health. That's why I'm on the call as well. I think this is a good fit for a lot of the work that we're doing, but more importantly, in the educational piece and the healthcare disparities piece, when it comes to the pediatric population, might be a really interesting thing.
Yeah, I think it sounds like, and it's good to meet you, Patricia, and thanks for joining today. It sounds like a good fit. I agree. I think that one, your current initiative is pretty holistic, and two, it sounds like you're speaking to what we know is a targeted initiative for SIPPS around the maternal health and things like that. So yeah, I think it's a great fit. I think it's okay that the partnerships are existing. As I said to Patrick's question, and it can go both ways here. Yeah. So if you have existing partnerships and you all wanted to lean into that program model and just devise a way to improve the impact and maybe serve X amount more people with those existing partners, I think that absolutely fits and is a totally viable project. If you did end up, for whatever reason, want to go the other way and just add more partners, you could say, hey, we have this replicable model, right? This is what we are doing. We want to replicate it with different partners. I think that too is a valid path for funding. But in both cases, it sounds like you check the box of having an existing eligible program or service, and in both routes, you'd be able to expand impact and service. So whether you intend to build off existing partnerships or pursue new ones, I think that's just a matter of where you all want to go with it. I mean, 10K is really generous, but 10K can go really fast with just educational tools. 100%. And that's what the students were doing. They were not only going into the Life Center to observe the young children, for growth and development, but they were setting up sessions to work with the new moms on parenting techniques. So yeah, okay. And we understand, I'm going to backtrack on my slide deck here real quick on the budget overview. As you said it perfectly, 10K is generous, and we're grateful for the funders offering it to 5 organizations. It also can go really fast. So even though we've offered out, this budget overview that could be all these different categories, honestly, we anticipate a number of project proposals come in and maybe only have 1 or 2 categories with spending, and so if it was something where you all just needed this software or this staff member, and that's the only thing that 10K is going to go to, as long as the justification is hashed out and we can see, like, okay, well, with this software, here are those deliverables, you know, that's great. That's what really we're looking for.
Perfect. Thank you. That's really helpful.
Yeah, absolutely.
Hi, Pat and Annabeth. I don't think you thought I'd be on the call. I'm sneaking this in between my my accreditation is due for my doctoral program in the fall, so I'm in accreditation lockdown. I've just been writing, but I snuck on the call.
Wow, what a multitasker. Good luck to you and congrats on that.
Thank
Liz,
you.
go ahead. I see your hand.
Hi. Oh, sorry, my camera's been off the whole time. I was like kind of eating lunch at the same time. But so I
That's okay.
am with Venture House. We are a mental health agency. We serve adults living with serious mental illness. And we recently, we received a grant from Council Member Kamala Hanks for a new media center, which we're actually having a ribbon cutting for. I know Tatiana's coming. I hope you can make it soon, Michelle, on the 13th. But with that grant, we were able to purchase, like the equipment and, like cameras and like the necessary tools needed for programming for that unit. And then we have this new media staff and we're really excited about that. But part of my job, as the outreach coordinator is, more kind of like outwardly focused approach. And I was kind of hoping to like collaborate with that unit and use that programming also for, like marketing and promotional purposes. So I guess my question is, would that be something that like we could apply for with this grant? So like, it wouldn't be like a concrete, it's not for necessarily for equipment and stuff, because we did get that, but I was thinking more for like promotion on social media, our website, things like that, because right now our biggest, one of our biggest challenges is kind of just making ourselves known. We've only been around on Staten Island for a few years, and 2 of those years we were in a pandemic and we were forced to shut down, and the city is kind of putting more pressure on us to recruit more members to sustain our funding. And so we have kind of like run ads before on Facebook and Instagram. It's just super, super expensive, but I do know that it actually works because we do have more, we have a new member this week that said that his mom came across our ad on Facebook a little while ago. And so I was hoping that, that could be something this could be used for.
Yeah, nice to meet you, Liz, and thanks for sharing. My instinct is that's a totally viable project. Yeah, when we go back to thinking about the purpose here, the core purpose is, of course, 1, to be addressing the needs, but 2, to really be enhancing service provision. So it sounds like your need is continued awareness and recruiting clients. You're looking to serve more people. And so a marketing project or an outreach project, I think, is right along those lines. My main, advice or guidance in that, and if you want to keep the conversation open, of course, as you're going through your draft, please feel free to reach out. But my main guidance is really think through your deliverables there. The deliverables, of course, it might be to run X amount of ad campaigns, but then when it comes to the outcomes, get real specific there about how that matters to the community. If it's X amount of ad campaigns, that will yield you how many new clients, and make sure that we now know what you do with your clients, right? These are the support groups we offer, the one-on-one counseling services, and these are the priority populations that we will target with this outreach, right? So just, I think as long as you're speaking to, in your narratives, speaking to those other elements that SIPPS is looking for, really helping us understand priority populations that you're serving and how you will serve more people if this marketing money came in. That's the move. When it comes to the barriers and challenges section, that's a great place to articulate what you just shared here. That essentially, the city's putting pressure on us. The city says we need more people, and that's how we will become more sustainable. That sounds like a challenge to me. And so, yeah, then your solution is, we're going to do this outreach work. We need marketing money, and here are the outcomes that we plan to tie to it. So, yeah, I think it seems viable. And again, I'll click back to my budget page, because that one, I guess, is a little more nuanced. I don't think we left a good, clean area for comms, as it were. So that could be something maybe you could reflect in other supplies, but it's not really that. It could be other technology if you're talking about running the ad campaigns, right? Because that is a digital platform. So if it's platform oriented or software driven, I think maybe put it in the technology section. And then this is why we left the miscellaneous column, right? We have that miscellaneous part at the end that's a catch-all. And it's not going to count against anybody to make use of the section as long as we get the description on the flip side so that we understand why that wasn't categorized anywhere else.
Awesome, thank you. So the only thing I am kind of worried about is I know like with the benchmark, like you said, the deliverables are more of like you're looking for those measured numbers and the outcomes is like more of the impact on the clients. But because that's the thing, like there is no like, guarantee. Like I do know that it will reach people, but there may not be like a concrete number that we can say like, 30 people, became members of Venture House via like that is something that we try to track is referral sources and where people come from. So like, if South Beach Psych refers somebody to us, we can say, okay, over the last year, we've gotten X amount of referrals. But with social media, it's a little bit harder. And there's no guarantee that maybe anything will even come of it. Like, so, we may get like more views and likes and followers and engagement on those platforms. But I don't know how, like, if it'll necessarily yield a certain amount of people coming through the door. So that's just like what I'm a little bit worried about is being able to say, hey, like we anticipate X amount of clients when, that's kind of hard to gauge. And it's social media is like really unpredictable that way too.
And marketing money is really hard to pursue.
Yeah.
That's why you look for these kind of micro grants and unrestricted things. And marketing money is hard to pursue for the reasons that you've shared. I think it can be helpful just thinking through, again, deliverables maybe being driven by the actual campaigns. We intend to reach X amount of people with these campaigns. You can maybe get creative, and I don't know if your organization has the resources for this, or if it's something that would fit back into this proposed budget or whatever, but like you could think about incentivizing referrals. And so you would say, maybe one of these outreach campaigns is about this refer a friend or refer a neighbor type of thing. And we incentivize those referrals. And, we expect X amount, that's where you could maybe put a light number to it, X amount of people to come in and we're going to give them, this gift card or something, So I think thinking through how maybe you can pair some incentives with outreach campaigning. And as far as impact, even if you, as you said, even if you got maybe nobody from your social media ads, or if you got just a few people from your social media ads, is there value in the ads themselves? Is there any outcomes around destigmatization, mental health awareness for the community? Is there any benefit to just having more reach, I guess, right? Could be a question that you consider when you try to put pen to paper on your outcomes.
Thank you. Sounds good. Thank you so much. That was helpful.
Sure. Folks watching the recording got a strategy session now. I'm going to get emails that have nothing to do with the app, just the project proposals.
I'd like to actually schedule a one-on-one Zoom call with you where we can,
right. But no, it's great though. And truly both of these examples, so different as they are, but that really is the heart of this opportunity. It's like every org and institution is going to have a different need. Some people really just need to get the word out. Some people just need software. Some people, and it's about thinking through how does that benefit, the community at large, and how can we build sustainable funding into that? So it's great. Appreciate you sharing the example.
Thank you.
Mm-hmm. I'm going to throw my contact info back on the screen just for one more minute. Since we're recording here just for one more minute, we are surprisingly at just about an hour and 4 minutes, which is as on time as I ever get. So thank you so much for the few who were able to join us today. Again, questions are welcome, of course, at any time, but also for the initial FAQ document. We'll be publishing that on July 7th. So feel free to email anything in advance of that, and we'll make sure not only to answer you, but to get it up on the website for others. Contact info is on the screen, and we look forward to reviewing a whole host of applications from across Staten Island. So thank you so much, everybody, for joining us. Forward to connecting.